Okay, this week's discussion is going to be on postural orthostatic tachycardia syndrome, better known as POTS syndrome. POTS. Is it causing your fatigue, and what can you do about it? So I'm Dr. Martin Rutherford. I am a chiropractor and a certified functional medicine practitioner.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
For those of you who haven't watched us, these are two separate professions, if you will, or two separate certifications, or that's
disciplines.
Not even correct. Disciplines would be a good term. And they both in and of themselves have tremendous benefit in many of the chronic conditions that are out there today. But we found out a while ago that when we put the two together, the nervous system tending to control everything, and everything in the functional medicine world tending to affect the nervous system, that this gave us a better opportunity to address the many vicious cycles that appear to be involved in most of these chronic pain syndromes. And so we have kind of inadvertently developed an autoimmune neurological practice, a chronic pain practice that seems to consistently come up with folks having autoimmune problems and or neurological problems as the key to what's going on. And I could even say that we're morphing more and more towards neurological issues, because we're finding that a lot of the conditions that we didn't even realize that the neurology was the biggest part of it, or a humongous part of it, as our local basketball coach would say, humongous. We didn't realize how much that was involved until just a couple of years ago. So that's what we do. And this week we're going to talk about POTS, because we have an awareness of it. We've had people come in with it. We have a decent understanding of what's going on. Dr. Gates, I haven't checked, but I'm sure has done his research again this week. So I'm sure we have a number of research articles attached. Postural orthostatic syndrome seems like it's something that can cause some serious problems. And I've seen people with a variety of severities of this condition come in to our particular office. Today we're going to talk about basically the condition as the conditions that it is associated with, how it can become involved in fatigue, how it's tested for, and standard therapies for this, and some causes that contribute to it, and maybe a little bit of what we see and what we do in these particular types of cases. So POTS.
So to start this discussion, we probably just have to have a general understanding of physiology as it pertains to standing up, because as most of you know, when you stand up for long periods of time, you get fatigued, and it's associated with you having your heart racing, you just feeling generally not well when you're on your feet. And so knowing that, we have to look at, okay, what is the normal physiologic response of standing up? And basically when we stand up, we may have like a drop of blood pressure, and our blood vessels will sense that. And so the brain will send signals to the heart to tell the heart to beat harder and faster in order to bring blood flow up to the brain, so all the blood does not pool down in the lower extremities. That's the normal response. However, in POTS patients, that response is not correct. And so it's amplified, so to speak. So you kind of overshoot the mark. Whereas other patients who just have orthostatic hypotension, where their blood pressure will drop, they're on the other side of the coin. So they can't maintain blood pressure when they stand up. Whereas when you stand up as the POTS patient, after 10 minutes, your heart rate starts to race. You start feeling not so well. You're not getting blood flow to your brain. And even your blood pressure may go up higher than it should be when you're standing, which can make it incredibly disabling for these patients to get through daily routines, to go shopping. Exercise seems like a bear, even though your doctor is telling you to exercise as a treatment for it. And because of that, POTS is quite a difficult condition to treat, in addition to the fact that it can be associated with a variety of other conditions like fibromyalgia, irritable bowel syndrome, anxiety. So the medications used for those conditions can sometimes fight the medications your doctor is giving you for POTS.
Yeah, and that's a good point. And again, people sometimes we get a lot of interesting comments on what we do, and one of the ones is like, "How do you guys know this stuff? You're chiropractors," or and on and on and on. But in the end, we have a lot of postgraduate work that has allowed us to do the work that we do. And how do we get the POTS? People do not generally come here with POTS, but they do come here with fibromyalgia, chronic fatigue syndrome. We see a lot of chronic fatigue syndrome. We see a lot of fibromyalgia. We're starting to see a lot of Lyme disease. We see a ton of anxiety. If you have listened to us for any length of time at all, you'll understand that we're kind of all over irritable bowel syndrome. And so that's kind of how we got involved with understanding the mechanisms of POTS. And what we do is we'll see that one condition starts to improve, and then we'll see that these symptoms will start to get better. And then Dr. Gates will go, "Oh, I think that's POTS." Those POTS symptoms are getting better. Well, how could they get better? Because we've been treating this and so on and so forth. So that's how the string has been pulled on this for quite some time now. I was just looking at a case yesterday. It's 5 years old. So you've been treating for 5 years at least, maybe 6.
In the clinic?
In this clinic.
Oh yeah, over 6.
Clinic. Yeah, so over that period of time, we see, for those of you who watch and know us or have been to the clinic, you know, we're not sitting around here twiddling our thumbs. We have a constant flow of patients all day long. So we have kind of like a ongoing clinical ability to experiment with these, because in the end, nothing that we do really is dangerous or makes anybody worse or anything like that. So I just say that because we get these, like the guy who's been giving you a hard time about I don't know, the autism. Was it autism?
It was a variety of subjects.
A variety of subjects, right?
You know, sometimes people they'll be online and they'll pose questions and they'll make their assertions, but they won't necessarily go back and read the research that we attach to each broadcast, because we do that on purpose. We're not just making these things up. We do that so you know that this all comes from the scientific community. Most of today's broadcast actually comes from the Mayo Clinic. Many of you patients have been told by your doctors, you know, "I know about POTS, I know the standard treatments, but I'm not really an expert in it. Go to the Mayo Clinic," because the Mayo Clinic is like the holy grail of POTS in this country, at least. And so we attach these references because this is the new information. And some people have first of all, they may have a stereotype about chiropractors talking about certain things. And secondly, they've been indoctrinated with, okay, well, this is what you do for X condition.
Which we're going to talk about a little bit of that.
And we'll go through that. And we always typically go through it. But then we also go into the newest of the newest research as to why people have problems such as POTS or ADD or autoimmune thyroid disease or fibromyalgia. And it's with that information that allows us to create natural therapies that we have had pretty good success with a variety of conditions.
So if you attack us, attach your references.
and
we love to see them,
exactly.
By the way.
Let's not argue emotion.
And we love to see
over the data.
So POTS, similar symptoms too.
Yeah, so it's very similar
fibromyalgia, Lyme, Ehlers-Danlos. Did you want to discuss those in a little bit more detail?
Yeah, let's just go into it. So a lot of POTS patients will have very similar symptoms to fatigue, because basically when you stand up, you get fatigued because you're not getting blood flow to your brain, your heart's racing off, you're secreting a lot of stress hormones, and that can create symptoms of fatigue. And so there are a lot of parallels between chronic fatigue and POTS, but you want to differentiate the two based on lab testing and
they're different mechanisms.
Different mechanisms, absolutely. And then fibromyalgia, a lot of POTS patients have associated aches and pains. They may actually have fibromyalgia in addition to their POTS. Lyme patients may have POTS in addition to their Lyme bacterial problem that's now being associated as an autoimmune problem. Ehlers-Danlos is a connective tissue disorder, can have genetic and autoimmune ramifications with it. So that's now being associated with POTS. So a variety of conditions are associated with POTS, and headaches, symptoms such as that. IBS or irritable bowel-like symptoms are very common in the POTS population, where they'll have nausea, or they'll have diarrhea, or they'll have constipation, or their stomach won't empty the food contents, called gastroparesis, or their stomach just all of a sudden will dump everything out after you eat, and so you'll get pain and bloating, and then you have diarrhea. There are a lot of associated symptoms with POTS, and that's why I said lots of times the medical treatment, they're giving you a drug for your diarrhea, or they're giving you a drug for your headache, and that those drugs may fight the drugs that they're trying to give you to battle the POTS.
Yeah. So, and notice that as Dr. Gates goes through that he mentioned a couple of times of autoimmunity. Another thing I hear is, listen, you guys are always talking about stress mechanisms. You're always talking about thyroid. You're always talking about gut. You're always talking about autoimmunity. And a while ago, we talked about autoimmunity, and it's just that all of these weird conditions that people seem to not have any idea as to what it is or how we're going to genetically look at. Every single one seems to be coming up autoimmune. Dr. Gates just got done mentioning Lyme that we did a presentation on a couple of weeks ago, and the data is there. The data is there. It's that ultimately it turns into an autoimmune disease, and then that, in essence, cascades into a number of other things that cause a lot of the symptoms that may be getting that may be getting I'm talking about the co-infections, maybe getting, boy, my brain just stopped working. The co-infections may be getting the credit for causing all of these symptoms as opposed to
the autoimmunity
problems,
right,
and
exactly.
stuff like that. And you're going to hear a little bit more of this in a few moments. So, and the reason is because that's what we keep seeing. That's what we keep. We're not trying to fit something into a box. We're just watching what comes up and what happens. And then when you do apply to it, what you apply to other, let's say, autoimmune or stress related or gut related or thyroid related cases, and the symptoms start to resolve and the patient starts to get better, it's kind of like, and you see that happen 5, 10, 15 times. It's kind of like, okay, that's autoimmune too. And we're kind of going to go down that track a little bit here. You put down here worse with menses and GI involvement. Did you already go over that? Or
I didn't go into that. Basically, POTS is worse with menses because your fluid volume changes around that time of the month. And that's why you may have POTS patients generally tend to have less fluid volume. And so if you reduce fluid volume even more, then your POTS symptoms can be exacerbated. Okay. And I think I covered the GI involvement.
Yeah. So let's go back to what we just talked about. Let's go back to the causes of POTS. And there are numerous, and you're going to see kind of a congruency here with things that we talked about over the past 120 hours or whatever that we've been sitting here, and some of the things we've mentioned just a few minutes ago. So small fiber neuropathy, one of our favorite things. We see a lot of small fiber neuropathy.
So with POTS, and I'm going to hit that, with POTS, there are basically two groups that they'll talk about in the research and the literature. One is too many stress hormones. So they can take a blood test and see that you have too many stress hormones, and they attribute your POTS being due to that. And I may even take a step back. But and the other one is what's called neuropathic POTS, or there's association with neuropathy. Now let's take another step back and look at how POTS is diagnosed. So basically you're going in, you have fatigue, you're saying, my heart is racing or I'm having heart palpitations. They may do what's termed a tilt table test with you, where you're laying down and then they raise you up, or they may just have you raise your head for 10 minutes, or they may stand you up for 10 minutes, and they'll see that your heart rate starts to elevate. They may even see that your blood pressure starts to elevate. They can take blood tests when you're standing up, and they can see that your stress hormones are really high. So as I said at the beginning of the broadcast, it's as though that normal postural response we have of trying to getting blood pressure up so we can get blood flow to the brain is overdoing itself, and you're secreting more stress hormones than you should, and your heart's beating harder and faster, and your blood pressure is higher than it should, to overcompensate. So why is your body overcompensating is the question. But in the medical model, they'll just say, okay, what do we see? And what they see is that there may be a lot of blood pooling down in your legs. So the question is, why are you not getting the blood flow or that blood from your legs up to your heart so you can get it up to your brain? And they did studies and they demonstrated that the nerves controlling the diameter of your arteries and arterioles, so basically they're called the sympathetic nerves. So those nerves and those autonomic nerves are not working well down in your lower extremity. So you can't get the blood flow from your legs up to your heart. And so they characterize that as a neuropathic POTS variety. And they associated with something we talk about commonly is small fiber peripheral neuropathy or autonomic neuropathy. So your nerves down there are dying and degenerating for whatever reason. And because of that, you can't get the blood flow back up to your heart.
Peripheral neuropathy, for those of you listening, is like, in this particular case, small fiber is going to be like pain, numbness, tingling, burning in your feet.
And you may not even have that in this situation.
Yeah, you could
you may just have the
you
autonomic
could-
component.
Okay.
Yeah, just to clarify. And you may have that too, because it
Right.
can be associated with small fiber neuropathy as well.
Right. Or you could be in an early stage of it
Mhm.
or whatever. But I just wanted to define what neuropathy was so that people might not be aware.
And then also with autonomic neuropathy, it can actually innervate your heart too. So your heart may not be getting the right signals also. So that could be part of it as well. And then there's the hyperadrenergic POTS. That's the too many stress hormones. So they see medically, okay, you have too many stress hormones. So what are we going to do? We're going to give you a medication to block stress hormones so that when you stand up, your heart rate is not going to go to 130 beats per minute. Maybe it will stay at 98 beats per minute, and that may allow you to feel better so you can walk around and do your daily activities. Now also, because they see that fluid volume generally can be decreased in POTS patients, what they'll do is they can put you on medications that will increase your fluid volume. So there's some thought that the adrenal glands, which control fluid volume, are not making enough of the right hormone to keep all your sodium in your body and keep fluid volume up. And so because of that, they can put you on a medication that basically mimics that hormone from the adrenal glands called aldosterone. The medication is fludrocortisone. Many of you may be taking it. And that will help you to maybe feel better. Then there's a medication called mitodrin, which will basically cause your arteries to constrict in your legs and get more blood flow to your brain. So I'm kind of trying to cover the medical side of it, but with understanding the medical side of it and the pathophysiology. You still with me?
Yeah, I'm just listening for some of the things that we had talked about before.
Mm-hmm. Okay.
If they come out,
and I say it that way because I'm always trying to make sure this makes sense.
Okay.
Now that we understand that basic framework, now we can get into the actual cause of POTS that's being demonstrated now. Yeah. And this is brand new research. It's from the Mayo Clinic. And what they're showing is that it looks like if you have POTS, that you have antibodies to a number of different tissues in your body affecting blood flow regulation. The newest research is showing that POTS patients have antibodies to adrenaline receptors.
Meaning you have an autoimmune problem. Okay. Meaning your immune system is attacking
these adrenaline receptors. So for example, adrenaline will make your arteries constrict down. Adrenaline will make your heart beat faster, as an example. It gets more complicated, but I'm just giving you the simplistic overview. So if you have antibodies to these receptors, then you're going to have to make more adrenaline in order to have the right response. I'll say that again. So if you're making antibodies to a receptor for adrenaline, then adrenaline can't bind to that receptor. So your body's going to make more adrenaline trying to get that effect so that adrenaline can bind to the receptor and your blood pressure can go up at a normal rate when you stand up. So this is why they're now thinking that POTS is autoimmune, because they're seeing these signs of autoimmunity in patients like you. And that is the explanation for why when you're standing up, all of a sudden your adrenaline, when they take your blood, is super high, and it shouldn't be that high, and your heart rate is at 130 to 140 beats per minute. So that's pretty cool. And then there can also be immune cells, antibodies, to another, let me say it this way. So when we're sending a signal to the heart, there's one nerve that goes to what's termed a ganglia, and then another nerve that goes to the heart. So it's like a two-way communication. Basically, the middleman in that communication, they're finding there are antibodies to that guy, and it's called an acetylcholine receptor antibody. So for all of you out there who are taking Mestinon or Pridostigmine, and your doctors tell you, well, we don't really know why it works, but it seems to work. In essence, what's happening is that the immune system is not allowing acetylcholine, which is a neurotransmitter, to work correctly at that little relay station. So as a result of it, they're giving you a medication that will basically allow there to be more acetylcholine at that relay station, and that will allow the communication to work better to your heart and allow you to feel better.
But that's getting attacked.
Yeah, so the immune system is attacking that acetylcholine receptor.
So you're giving the receptor. So it's we're attacking the receptor and not the acetylcholine.
Yeah, so attacking the receptor. So that's 25%.
This is new.
POTS patients. No, it's brand new stuff. So 25% of POTS patients, especially in pediatrics, are shown to have that acetylcholine receptor antibody. The adrenaline receptor antibody is now being seen much more commonly in these new studies. And then also, basically, they're seeing that the immune system is attacking a variety of different tissues in the heart of POTS patients. So as Dr. Rutherford was saying before we came on this broadcast, you know, his mentor, Dr. Krosian, really brought up how a lot of these conditions are autoimmune.
Oh,
and
years
he was,
ago.
you know, given the stuff that we're talking about now and some of the pushback we get, because people just, again, they have a model for Lyme disease, they have a model for thyroid, and they don't necessarily, it's hard for them to think outside the box and say, okay, whoa, it really is the immune system. It's not an infection as much as I thought it was. Back when Dr. Krosian was talking about this 10 years ago, he was lambasted for some of the stuff he was saying. But really over the last 10 years, the literature has just exploded. There's been an exponential growth in our understanding of why so many people have conditions like fibromyalgia or POTS or chronic fatigue, and we can go on and on. And really it boils down to the immune system. And so we have an autoimmune problem in our country. 1 out of 6 Americans, as of the most recent estimate, has an autoimmune issue, but 1 out of 3 females have an autoimmune thyroid issue. So it's probably more common than 1 out of 6.
Oh, probably way more.
We're now seeing this with conditions like POTS. And this, everything I'm talking to you about in terms of this new information, most of it is coming out of the Mayo Clinic.
Yeah, for those of you who have POTS, then you're like, well, I got all these other symptoms. This is where the confusion comes in with fibromyalgia, because who has one autoimmune tissue being attacked?
Right.
Nobody. You almost always are going to have multiple tissues being attacked. How many of these patients have Hashimoto's? I know I'm interviewing him and I'm thinking, well, it sounds like they got a stress mechanism. It sounds like Hashimoto's. It sounds like adrenals. Those are the things, and those are the areas involved, but in a different way than I'm looking at, than I was looking at them when I was interviewing these folks. These are because not knowing, whoa, these are actually autoimmune attacks on these different areas, which is different than having adrenal fatigue and taking cortisol or taking an adrenal supplement, and all of a sudden you're doing better. Okay. So it's pretty wild. But I mean, right now, it's almost like when Dr. Krosian started talking about that, and I think it was even more than 10 years ago, he was lecturing before I met him. And it was hard to embrace. It was hard to sit there and hear what he was saying. And he said there was this vast underlying autoimmune population that was developing into this chronic pain population that at the time wasn't really being acknowledged the way it's being acknowledged today as such a drain on the financial system. So people are starting to actually look at it. And at that time, there was like 35 or 45,000 chronic pain patients designated by the Stanford and Harvard. And
was that million? 35, 40 million?
No, it was like 35, 45 million. What did I say?
You said thousand.
I'm sorry, million. But now it's 130 million chronic pain patients. And the more the research comes out, the more it's seeming like maybe our immune systems are maybe a little bit too much under attack. Maybe it's the stress. Maybe it's all the, you know, we're not anti-medicine. We're vaccinations. I know they got their thing, but I mean, 60 vaccinations by the time you're 8, isn't that like the schedule that we have down there on the board? It's somewhere close to that. That's a lot for the immune system, maybe, to handle continual antibiotics, these types of
antibiotics, the stress, the food. I mean, we're just,
and all we're doing is ticking off things that affect your immune system. We're not being like jerks or anything like that, or, you know, it's just a matter of the immune system is attacking. It can attack anything, obviously.
Right. And we have millions of mechanisms in our immune system to make sure things like this never happen. We're not supposed to make antibodies to adrenal receptors. We're not supposed to make antibodies to acetylcholine receptors. We're not supposed to make antibodies to the thyroid in 1 out of 3 females. So as Dr. Rutherford said, these are just ideas that are being talked about in literature as to why the immune system is breaking down in the American individual.
Right. Even in the medical literature, the things I'm talking about are being discussed. Even about the antibiotics, even about the vaccinations, things I'm seeing more and more medical authors discussing. Right now, they're basically not discussing is there stuff in there that's causing this and that, but they are starting to go, hey, this is a lot of vaccinations.
Yeah, they're starting to say, is it too much for the immune system? Do we have to spread them out, or all those factors? So
who knows? But the medical treatment does not really address the autoimmune.
Yeah, so the medical treatment right now is wear compression stockings to try and get that blood that's pooling down in your legs. If you have autonomic neuropathy, well, let's just put you in compression stockings and see if you feel better. Let's put you on midodrine to basically give you more adrenaline, so it can basically bind to those receptors that are being blocked by antibodies, so that you can function normally. Let's put you on mestinon or pyridostigmine, which is an acetylcholinesterase inhibitor. So you have more acetylcholine at that relay station. Let's put you on fludrocortisone, so you have more fluid volume. Those are basically the medical treatments. And let's exercise you. So that's the new one. So studies have shown that with POTS patients, if you get them exercising, they will generally have an improvement in their cardiovascular function, their blood pressure, and their heart rate variability. But for a lot of you out there that we talk to, it's almost impossible for you to exercise because you feel so fatigued when you're standing up. So how are you going to go run? You can barely get through your daily activities.
Right.
Other alternative treatments that are being talked about, B12 is being shown to somehow...
The infamous B12.
Baroreceptors, choline. So we talked about acetylcholine. Choline, just taking it by itself, has been shown to maybe help POTS patients. And I think I pretty much covered all the treatments. I just want to make sure that I'm not missing anything. All of the
medical treatments.
Yeah, all the medical treatments. Really the functional treatment. And we do have some ideas for those of our patients who have POTS out there that I'll be talking to you about privately. But the treatment generally with these autoimmune conditions is to go back to the gastrointestinal barrier, because that's where 70% of your immune system is. We have tremendous success with that across a wide spectrum of conditions. Yes, we've had some where we have to go a little further. Some of you may need to be referred for consideration of an immune therapy from your doctor, from an allopathic approach. So that's the treatment in essence.
And just to expand on the GI thing, on the gut thing, it's 70% of the GI of the immune system is in the gut, but you pretty much need to deal with everything that is flaring up your immune system. Okay, so that's what Dr. Gates is saying. There's a lot of things in the gut that have now been shown to create immune responses. Over the past couple of months, we've talked about bacteria that have been shown to potentially be causing multiple sclerosis. It has been established for sure, rheumatoid arthritis. There's stuff in there that causes antibodies against your brain, antibodies against your thyroid, and on and on and on. So the gut seems to be where it's at. We found that, but the bottom line is this, is that everything, whether it's bacteria, whether it's blood sugar, whether it's thyroid, whether it's iron, anything that's creating inflammation, anything that's creating an ongoing immune attack, you have an H. pylori in there, you have an Epstein-Barr, literally it's all on the table. And you have to figure out what is in that particular patient's profile, and then you have to address it in that manner to calm down all of those things, many of which you have experienced or been told can't be done, but all of the things I just got done mentioning can be dampened down and then some. So, and stress mechanisms and overfiring sympathetic stress mechanisms, the midbrain that Dr. Gates talked about just briefly here.
And a lot of you POTS patients know your doctors have sent you for counseling and for behavioral therapy, because they talk about the fact that a lot of you basically have anxiety. You probably have anxiety because you have so many stress hormones floating around in your system, because you have antibodies to adrenaline receptors. That's why you have anxiety.
So you calm all that down, the anxiety calms down, the gut calms down, the immune system calms down, and then things start working better. So that's kind of the, the cliff notes of how it works. I mean, if you want to know things about it, we have something online about how we do the brain work, and we have something online about how we do the functional medicine. We should probably update that one, actually. Okay. Because that was a couple years old. Okay. But yeah, it's an autoimmune problem. Apparently, and that makes sense, because that's how we saw POTS improve, by treating other patients who had autoimmune problems. So if you have any questions on that, or if you're going to attack us, send your references. We're not here, by the way. Look, we're just hanging out here, sharing stuff with you. Okay, we're not selling anything. We're not. I mean, we have something online that says if you want to become a patient, it's online. You almost never hear us mention that. I think maybe I've mentioned that like 3 times in 100 hours or something along those lines. We're sharing. When we share, people give back. When people give back, it gives us more data. We're not here to save the world or anything like that. We're here to help people who are sick, maybe looking for another way out, a potential that might help them to understand that maybe there's more things to look for. We talk to doctors, frankly. And we're always open to engaging in a conversation about these matters. So, but the attack us is like stupid, because we're not here We're not here like trying to kill the pharmaceutical companies or take these doctors out. Lyme disease is an autoimmune problem. That's the science. We've seen it. It's not like we're here to like make some sort of a stand. Okay. Right. The stand is, if you got Lyme disease and you're not getting any better, you might want to look at it from the perspective of an autoimmune problem, and so on and so on. POTS being the same. I've observed POTS patients. It's hard to watch. That, the person's hardly able to get up. They can't walk around. They have no energy. I mean, it's difficult. That's a challenge. And if you have another way to look at it that might be more successful than the one you're looking at, that's all we're doing. So you're welcome to reject anything we say. Just send your literature and maybe your clinical results or your clinical expertise. Don't call us with the latest multi-level marketing thing that's going to fix it, because it's not. These are multiple vicious cycles that are involved in multiple autoimmune attacks on multiple tissues, and they need to be handled in a very organized fashion. And so that's it. We just want you to know that there is a way, and that there are other things you can do, and that there are doctors that are doing this. So until next week, I think that covers it. Until next week, hope that was helpful. Send us any of your questions. No, don't send us your questions. We don't have enough time. We don't have, Dr. Gates doesn't have time anymore to answer them all. And but any comments or any suggestions for topics, any studies you think he hasn't looked at, which probably are none, but you can help us with that. That's fine. And we'll try to come up with another interesting topic, hopefully interesting topic, for next week.
Okay. Thanks for watching.
All righty.